We have previously featured interviews on wearable cardioverter defibrillator therapy, and now there is a science advisory on the use of these devices for the prevention of sudden cardiac death. To talk about that, I am with Dr. Jonathan Piccini, MD, who is the lead author of the advisory and a cardiac electrophysiologist at Duke. This is something new. This is the first time that an organization has come out and offered some advice on this, right?
That's right. The American Heart Association, particularly the Electrocardiographic Arrhythmia Committee within the Clinical Cardiology Council, recognized that these devices are being used more frequently in clinical practice, yet there are no guidance documents from any of the professional societies. So this science advisory was commissioned for several purposes, including provider education, education of the public, providing a framework for where there are unmet needs in the research infrastructure, and providing a general framework for around how these devices might be used in clinical practice despite the very limited evidence.
Now, they're not guidelines. We probably should mention that right up front.
Yeah, no, that's a very important point. This is a science advisory. So it's not a guideline document. It's not meant to be prescriptive. And one of the things that the document, I think, emphasizes is that blanket use of these devices really is not appropriate. And as we point out in the document, there are no completed clinical trials using these wearable defibrillator technologies. Hopefully we'll have one very soon, which is the VEST study, which hopefully will be presented within the upcoming year, which is randomizing patients to VEST therapy after myocardial infarction.
Well, these things kind of look like a fishing vest, don't they? I mean, right now that's where they're technologically at, but isn't it true that they're also trying to advance the technology to the point where it's lighter, more comfortable? I think one's like a bandage approach, and it's like, really? That's interesting.
Yeah, all of electrophysiology is, there are a lot of innovations with wearable devices. And right now the wearable cardiac defibrillator is kind of like a glorified fishing jacket, at least that's how many of our patients describe it. And it's bulky and it has a very large battery pack. And one of the challenges with the wearable defibrillator is adherence. If the patient's not wearing it, they're not going to benefit from it. And at the same time, it can be very uncomfortable. So engineers and biomedical scientists are working on miniaturizing these devices, making them into self-contained units and even adhesives. And so there are there's lots of work in the engineering field to get us to more innovative, better devices that might have better compliance rates and serve additional unmet clinical need.
Besides, we need more data, what else are you actually coming to the fore with in this document? What are you advising in this advisory?
Sure. So one important thing is that clinicians need to be familiar with these devices, and there needs to be some general understanding of how they work. The committee and the advisors to the document all recognize that this is a very frequent question in clinical practice. How do we use these devices? How do they work? When are they appropriate? When are they not appropriate? So education is a prime goal of the document. If the science advisory leads to proliferation of grand rounds discussing these technologies, that's a win. So education was a key goal of the document. But we do provide, and the term we use, which we think is very helpful, is a general rational framework for the use of these devices. So we do go ahead and articulate the certain circumstances where the use of these devices might be helpful. So for example, some patients have an implantable cardioverter defibrillator and it needs to be removed, either due to infection or radiation or some transient condition, and the wearable defibrillator might be useful there. There are other conditions, transient risk after a myocardial infarction, transient risk in women with peripartum cardiomyopathy that might resolve at a later date. These are situations where the wearable defibrillator might be helpful, and again, we need clinical trials and additional clinical research to help us understand which patients will benefit and which won't.
And this is online before print in circulation, correct?
That is correct.
And one thing you say towards the end is, in the meantime, larger randomized and controlled clinical trials of the wearable defibrillator and similar technologies are critically needed before they are used widely in clinical practice. I mean, that's where we are at right now. We need more data, but until then, please see this.
That's right.
This is for circulation, so please make sure you check at the end of the video because we have the citation there. And for CardioSource World News and CardioSource World News Interventions, I'm Executive Editor Rick McGuire.